A call to retired nurses to help private healthcare facilities in the fight against COVID-19 has left nursing union DENOSA uneasy.
The first option that the private sector has got to explore is to ensure that employ all healthcare professionals that are sitting and not employed currently. We've got a lot of nurses who are not employed as we speak, and we think that instead of focusing on maximizing profits, they should also understand that we are in a pandemic, and the type of healthcare that we deploy should be one that responds to the challenges that we have as a country.
The unions say hospitals should look at retired nurses only as a last resort, as they are more vulnerable due to age and comorbidities.
To call on retired nurses, knowing very well that comorbidities expose people to be more susceptible to the COVID-19 virus, somehow smacks of being irresponsible. But at the same time, it also tells us that the main priority is around saving money, because they're running away from employing permanent people.
Private healthcare facilities were also not left immune from the hard lockdown of 2020, which left them under increasing financial pressure. Last year, Life Healthcare, Mediclinic and Netcare reported billions of rands in losses. Mediclinic says it's initiated the volunteer process after the community expressed intense interest. This is also over and above extensive recruitment.
For this purpose, we have a formal volunteer program where volunteers can register as well as receive training and orientation to assist in the area where they've indicated their willingness to assist. Volunteerism in healthcare is well established internationally, and we've always felt that this is something that has been lacking in our communities, to tie a local hospital closer to its community. Through this process, we feel we are getting closer to our communities and fighting this pandemic together. We are extremely grateful for all the offers of support and all the other acts of kindness that has been extended to the healthcare workers on the front line. We value the well-being of our healthcare workers and have a formal mental health support program for them. This consists of face-to-face counseling if needed, telephonic counseling if needed, as well as online resources and debriefing after shifts.
With the rising number of hospitalizations due to the second wave, the hospital group says that while resources remain under significant pressure, they will continue implementing additional measures to meet the challenge. Nozintombi Mia, SABC News, Johannesburg.